Now, in recent years, there have been some remarkable developments in the detection and treatment of cancer, with many survivors going on to lead long and healthy lives. However, a 5-year study published in the British medical journal The Lancet reveals that patients with certain types of cancer often stand a better chance of beating the disease, according to where they live in the world. Well, joining me in the studio is Professor Michel Coleman, who's one of the authors of the study. A very good day to you. It's quite an extensive study because you looked at over 25 million cancer patients. So how many countries did the study take in?
The study covered 67 countries around the world, including 9 African countries. And we explored the patterns of survival, as you say, for more than 25 million patients diagnosed over the last 15 years. There were huge gaps in cancer survival around the world. Very high levels of survival in some of the wealthier and more developed countries, as one might expect, but extremely low levels of survival in some countries, including some of the African countries. And the problems are that some of these countries have poor infrastructure, not only for treating cancer, but also for recording information about what happens to cancer patients. And some of the cancer registries that record the disease, either in a whole country or a part of a country, were unable to participate in the study, even though they wanted to, because the quality of their data was inadequate. And that is due to lack of resources.
Right, so that could effectively give us, well, understate the picture. So we know it's bad, but we don't know how bad things are simply because of that data gap.
That sums it up perfectly. And some of the problems faced by cancer specialists and indeed cancer registries in Africa, for example in Nigeria, where Wole Soyinka has just declared that he had cancer or had cancer about a year ago, and has called on federal and state governments to set up cancer centers and cancer research centers to improve management of the disease. One of my colleagues in Ibadan, Nigeria, Professor Ogunbiyi, has said that some of the women who come to him or come to his hospital for treatment for breast cancer, they go away after one treatment and are never seen again. And this is really difficult for him to manage their disease, but also to record what happened to them afterwards. And this is a pattern that repeats itself across Africa.
But that also points, for example, to education awareness, because in the United Kingdom, we take it for granted that you've got high-profile cancer charities which are advertising on the television. They're actually organising fundraising among supporters, etc. Going to a GP surgery, there are cancer leaflets, but you don't see that replicated elsewhere across the world, alerting people to early detection, particularly for things like breast cancer.
Yes, I think that's true, but it's not only public awareness. It's true there is a lack of public awareness in some countries, and in other countries there are also myths that cancer is so difficult to treat and lethal that there is no point going to get treatment if you feel that you may have cancer. And this kind of fatalism, this myth that cancer cannot be beaten, cannot be treated, actually contributes in a rather vicious cycle to lower survival in some countries, in Africa, but also in Asia and other parts of the world. And this is a myth that needs to be broken. It's part of the World Cancer Declaration from the Union of International Cancer Control, that these crazy myths that cancer cannot be treated need to be broken by information, by educating not only the public, but also politicians.
I was going to say, they are crazy myths, but how do you start deconstructing them? Because myths do have a very powerful hold in some communities.
Yes, they do. One of the ways of doing that is by offering treatment and making it clear that this can help and improve survival. And in Jordan, for example, the provision of new cancer services and information showing that this actually succeeds in prolonging survival of cancer patients has caused many more patients to come forward for treatment earlier than they would otherwise have done, and therefore to improve survival. But it's not only patient awareness and the availability of facilities for diagnosis that counts. There are 30 countries in the world, many of them in sub-Saharan Africa, that have no radiotherapy equipment whatsoever. And radiotherapy is one of the key modalities of treatment for cancer. Surgery, of course, is probably the most important for the major cancers, but radiotherapy comes a close second. And probably half of all cancer patients would benefit from radiotherapy at some point in the course of their disease. And if your country has no radiotherapy facilities, well, I need not go on.
Sure, but then that leads to the question of health finance, because, I mean, this is the fascinating thing about your study, and indeed others that have backed it up. It's not just looking at the hardcore medicine, looking at the statistics to actually gauge life expectancy. It also touches on this area of health economics, because you do get the impression that in some countries, particularly those where you're going through some restructuring after a period of chaos, civil war, rebuilding a health industry is not necessarily seen as a priority. It's important, but perhaps for some it's less important than building schools, building homes, getting people employed.
Yeah, that's true, and 4 or 5 of the countries that contributed to this study from Africa have undergone civil or military conflict of a major character in the last 5 or 10 years, and so it's not surprising that their infrastructures are in disarray in places, and in some even absent. But the importance of cancer is huge, and as a public health problem, there are few to beat it, if you will. Infection has come under greater control in many African countries, and cancer is increasing as a problem of public health importance. And it is important for governments to devote a sufficient proportion of their national wealth to providing structures that can deliver health care to their population.
So in other words, telling governments, look, you can't see a healthcare system as outside of the infrastructure. It's an essential part of that infrastructure. Get it working, then the one feeds into the other effectively.
I'd agree with that, because cancer is not only a problem of public health, it's an economic problem. The cost of cancer in lost economic productivity and the costs of treating it are over $1 trillion worldwide. It's an economic problem that represents somewhere around 2% of the global gross domestic product. It is a huge problem, and it requires investment to deal with it.
It's interesting as well, just sticking with the theme of economics, because obviously we have a number of countries in Africa which are being hit at the moment by the Ebola epidemic. And again, that has stressed the importance of having an efficient, workable health system, because, again, this disease has undermined the economic base of a number of these countries. So perhaps, again, is that something which health campaigners will look at and say to people, look, see what Ebola has done. Cancer can have a similar effect. Just as you're responding to Ebola, you've got to look at cancer in much the same way. Even though effectively they're different conditions, they still have the same impact. Children are orphaned, communities can be undermined.
I'd agree with all of that, with one exception or one difference, in the sense that Ebola very obviously is an acute disease, and what we're looking at now is a very substantial epidemic with acute and severe loss of life, mostly in Western African countries. Cancer is a problem almost like the so-called elephant in the room. It's been there with us for decades, and it will be with us until the end of the century, long after we can very much hope that Ebola has been defeated with either treatment or vaccination of some kind to prevent it. Cancer is going to be around for the rest of this century. It's a public health problem that every government is going to have to deal with, and it's long-term. It requires investment. It requires training of the specialists who need to deal with it. It requires development of the infrastructure needed to deliver early diagnosis and treatment. That is something that goes way beyond the management of an acute epidemic, however severe that epidemic is, as in the case of Ebola.
This study took 5 years out of everyone's life, effectively, looking at the developments, looking at the number of people, the treatments, etc. Let's look ahead to another 5 years. If somebody picks up the reins, be it yourself or another one of your colleagues, what do you think that picture will tell us?
Well, I don't know. I don't like to make predictions, but I would very much hope that what we will see in this program of long-term global surveillance of cancer survival is that we will see steady improvements. We don't expect to see spectacular changes unless there's some magical new treatment that transforms the prospects of cure for a particular type of cancer. That would be welcome. But on the whole, I would expect and hope that there will be steady progress in cancer survival in many of those countries where it is currently the lowest in the world.
So you're guardedly optimistic?
Yes.
OK, then, Professor Michel Coleman, thank you so much for joining us here on This Day Live. Thank you.
You're welcome.